Hello, this is Dr. Mark Lebwohl. I'm Chairman of Dermatology at the Icahn School of Medicine at Mount Sinai in New York. I will be discussing Tildrakizumab, a selective anti-IL-23 monoclonal antibody, subjects with chronic plaque psoriasis who do not adequately respond to Etanercep, a poster that was presented by Dr. Christian Reich and colleagues at the American Academy of Dermatology annual meeting in Orlando, which took place from March 3rd to March 7th in 2017. To summarize the results of this poster, patients with moderate to severe plaque psoriasis who did not achieve PASI 75 response with Etanercep by week 28 were able to achieve clinically meaningful improvement in chronic plaque psoriasis upon switching to Tildrakizumab. Tildrakizumab is a high-affinity, humanized monoclonal antibody targeting IL-23p19 with demonstrated efficacy in the treatment of patients with moderate to severe plaque psoriasis. This study is important because Etanercep is an important treatment option for patients with plaque psoriasis, but not all patients achieve adequate improvement and symptom relief. For these patients, Tildrakizumab may be a good treatment option. And here's how that study was designed. The poster presents the results of patients in the Resurface 2 study who had achieved partial, meaning PASI 50 to PASI 75, or no response, meaning less than a PASI 50, when treated with Etanercept 50 milligrams at week 28. At week 28 of Resurface, 120 of 313 patients treated with Etanercept were partial responders or non-responders and were switched to Tildrakizumab 200 milligrams. Tildrakizumab was continued until week 52. And the main findings were as follows. At week 52, which meant there were 20 weeks on Tildrakizumab, PASI 75 was achieved in 81.4%, PASI 90 in 41.6%, and PASI 100 in 15.9%. Physicians' global assessments of clear or minimal disease, meaning a score of 0 or 1, occurred in 68.5%. During the retreatment phase with Tildrakizumab, 51.7% of the 120 patients experienced an adverse event. A serious adverse event was observed in 5 patients, or 4.2%. Nasopharyngitis was the most common adverse event, occurring at 11.7%. Bronchitis and upper respiratory tract infection occurred in 5.8% and 5.0% of patients, respectively. So the main take-home message here is that even in Etanercept failures, switching to Tildrakizumab, an IL-23 blocker, resulted in dramatically beneficial responses.